Every patient has a legal right to good quality medical care, and the healthcare provider is obliged to uphold that right. However, medical negligence is quite common in Uganda, although the statistics on the vice are vague. In 2011, Andrew Odongo began experiencing excessive salivation and vomiting, a health condition that would eventually lead him to the edge of the abyss. Odongo is the Sub-County Internal Security Officer, or GISO, for Kalongo Town Council in Agago District in northern Uganda.
It was on and off. But when it came to 2016, the problem intensified. I started getting medical assistance from Kitante Medical Center. From there, they operated me.
Odongo says the stomach bypass surgery was meant to rectify a venous obstruction. However, he ended up remaining with only a quarter of his stomach.
So after that operation, the problem continued. So I decided to go to Mulago myself. When I went there, they asked me whether I have the record of the previous operation. So I said no. For Kitante, they kept the record. They don't give out the records.
Article 16 of the Patient's Charter of 2009 upholds a patient's right to medical information. The patient is entitled to obtain from the medical facility his or her medical information, including a copy of the medical records.
This is a referral letter.
Because Odongo did not have medical records, doctors at one of the surgical wards in Mulago Hospital cut him up twice in the same place to collect samples to inform their diagnosis.
They confirmed that there's cancer. They referred me to Cancer Institute, and the result was not even clear. The doctor was not contented with the results. 2018, I stayed without any medication.
But how are you feeling during that time?
There was total weakness. Color of my eyes, yellows.
In late 2020, the results showed that Odongo had a malignant tumor on his pancreas. He was diagnosed with pancreatic cancer.
So they started giving me chemo. Yes, about 4 to 5 cycles of chemo. And there was no improvement.
From November 2020 to January 2021, Odongo underwent palliative chemotherapy for a cancer he did not have. While chemotherapy is used to cure cancer, palliative chemotherapy is used when the cancer has spread and the goal is to prolong life for a few more months. Misdiagnosis can result in serious health conditions and sometimes death. Surprisingly, when he tried to stop the cancer treatment, Odongo met challenges.
So he again requested for another test. I went to Mengo and I did from there, and the result came that there's no any cancer. I told them openly that I'm not going to continue with any treatment from here now. What I want a referral letter from you. They refused to give me the referral letter. I met the director for Cancer Institute. So he called Dr. Bayo and I talked to him. Then he agreed to give me a referral letter.
Article 13 of the Patient's Charter gives everyone the right to be referred for a second opinion. Patrick Murungi Ngasira, a legal officer with the Women's Pro Bono Initiative, says every patient is entitled to be treated at a facility of their choice.
It's not correct or it's not right for a hospital to hold you at ransom and say, we cannot give you a referral letter, we can manage you. You are entitled to go to any facility that you think can be able to handle your problem.
From 2022 to January 2023, Odongo underwent tests at the Aga Khan University Hospital and treatment at the Nairobi West Hospital, both located in Nairobi, Kenya. He was diagnosed with obstruction of the bile duct and underwent a stent placement surgery. Although Odongo is now well, his quality of life has deteriorated. I think he blames on the medical negligence he experienced.
What he did, it is permanent. He has reduced the size of my stomach. Chemo, you know chemo. Chemo is not it's not like other drug. It's a very strong drug. So it has given me total weakness in my body.
Blix Oyet, Odongo's brother, says the amount of money the family spent over the years is over 120,000 US dollars, or close to 500 million shillings.
Not only the money side, but also stress, because we expect that when you come to the big hospital like Mulago, we would get help.
In a telephone interview with NTV, Dr. Jackson Orem, the executive director of the Uganda Cancer Institute, advised Odongo to seek redress from the Uganda Medical and Dental Practitioners Council if any acts of medical negligence were committed against him before seeking legal redress in the courts of law. Last year, the Uganda Medical and Dental Practitioners Council indicated that over 50 complaints are made against medical workers annually. Odongo is yet to register a complaint. Gillian Nantume, NTV Tonight.